Hi, Namaste. As a part of World Hearing Day, today we are here with Dr. Vijay Prakash sir, renowned senior consultant ENT. Hi sir, good afternoon.
Good afternoon, Ashwini. Thanks for your kind introduction.
Thank you, doctor. So, let us know about the importance of newborn hearing screening.
Okay, newborn hearing screening basically refers to identifying newborn children with hearing loss. It is very, very important that we identify these children because it has got lifelong impact on the growth and development of child. A child who is able to hear is able to participate in all kinds of communications with the world. He is going to develop or she is going to develop language and communications. They can enjoy music and other activities. And that's why it is very, very important that the child be identified early in their development, so that we don't miss up the child with the hearing loss. With the present modalities of treatment, a child, if identified of hearing loss, can be managed very well, and we can provide them a near normal lifestyle in future.
So, what are the things that parents should be aware of as soon as they have a baby, or like a milestones before a new they should know of?
Well, the parents, particularly for new parents, it's very, very important that they know certain milestones with regard to hearing for a child. Okay, for example, a child who startles to loud sound most probably has got a normal hearing, and this is a very, very important sign that the parents must be aware of. Other than that, parents should also know certain milestones in their child's development. For example, by 3 months, or 4 months, the child will be making some sound like cooing. Okay, this necessarily does not need to have any meaning. By about 6 months, the same child should be able to say simple monosyllables or bisyllables like mama, papa, bye, and this probably may not have any meaning as such. All right, and by about 12 months, the child should be able to, respond to his or her own name, and that is very important. At the same time, the child should be able to speak, words like mummy, papa, bye, and things like that. By about 2 years, most children will have a vocabulary of about 50 words. Okay, anything which is less than that or deviating from this normal progress of development should raise an alarm in parents' mind.
So, doctor, what are the most common ENT related surgeries that are more common in infants?
All right. So, Ashwini, if we were to talk about ENT related surgeries in infant, okay, that refers to ear, nose, and throat problems. Then there are, at that age, that is in infancy, which is less than 1 year of age, we particularly look for a lot of congenital anomalies, okay, which are related to ear, which can be related to the nose and the throat. So I'll cover them one by one. For ear related issues, the common ones are birth defect with related to ear. For example, the pinna is, or the outer ear is partially developed. There are of course various grades to it. Then the ear canal can be narrow. We call it oral atresia. Then again, there are a variety of grades to it. So the ENT surgeon has to be vigilant in identifying these problems. Sometimes the child may have a hearing loss, which may be a function of, you can say, a middle ear or inner ear problems. Okay, and other common things which are again found in children of that age, which are not in congenital category, are ear wax, fungal infections of the ear. Coming to the nose, similarly, like ear, we have to be looking for a lot of congenital anomalies in the nose. For example, we call something called as piriform aperture stenosis, which is basically narrowing of the front part of the nose. This causes the child blocked nose and repeated nose infections. Another common thing is corneal atresia, which is basically narrowing or near complete closure of the back part of the nose. This particularly causes severe problem to the child. They have difficulty in feeding, and this is more like an emergency which we have to identify and intervene. Similarly, we have a lot of congenital anomalies related to the neck and throat, which also can cause severe issues with regard to their breathing or swallowing problems. All of these we need to maintain high vigilance and identify them as early as possible, because often at times it impacts not only their quality of life in future but also their immediate survival.
So, doctor, what are the common myths about hearing loss that a lot of people assume and about the treatment regarding the hearing loss?
Right, Ashwini. Myths and treatment regarding hearing loss, I would like to say that, most patients or the parents rather think that hearing loss is temporary and it should resolve on its own. Well, that's not the case. We have to be very vigilant in identifying patients early so that right intervention can be done. And these interventions can be form of simple procedures to more complicated surgeries. Another common myth that I come across in my practice is that is a all or none phenomena. A lot of time, when I mention about hearing loss, patients tend to feel that, or the parents rather tend to feel that the child cannot hear at all, or the patient cannot hear at all. But that's not the case. For hearing loss, there are grades of hearing loss, and a trained audiologist will be able to identify the severity of hearing loss. Based on the severity of the hearing loss, the treatment is according to the severity.
So, doctor, what are the professions through which that they have prone to a hearing loss, or they have high exposure to get a hearing loss?
Right. So I'll try to put this into two categories of patients. One is those who are exposed to loud sound. This can be short duration loud sound or prolonged duration loud sound, and those who are exposed to, you can say, near comfort level of hearing, but for a very prolonged durations. So in the first category, where patients are exposed to loud sound, for example, those who are working in construction industries, drill works, those who are in aviation industries, those who are in mining industries, these patients are exposed to loud sound. Gunshot injuries is an example. Also in our armed forces, where they need to use good protection to protect them from hearing loss. What I want to mention in this category is that these kind of hearing loss, which happen due to certain exposure to loud sound, are generally permanent, and therefore immediate intervention or medical treatment may be required as soon as possible. The second category belongs to those patients who are exposed to near normal threshold of hearing, but for a prolonged duration of time. This is a new entity, and this is what we have been encountering in patients who belong to IT sector or back office people who use headphones, and they have to use these headphones for meetings and taking up calls and variety of other reasons for a prolonged period of time. These patients may not develop a sudden hearing loss, but the initial manifestations of like discomfort on prolonged exposure to sound, pain in the ear, and gradual hearing loss is what we see. In this case also, immediate seeking of medical, as soon as you notice the problem, you should see a ENT doctor, get a hearing test done, and then the treatment can follow after that.
So, doctor, what are the main causes of hearing loss in elderly patients?
All right, Ashwini. So earlier you asked me about the causes of hearing loss in children. So now we are going to talk about hearing loss in elderly patients. All right. So in elderly patients, I'll try to put the causes of hearing loss into three categories. The first one would be the natural cause of the hearing loss, which, like all body functions, tend to decline as you age. Hearing sensitivity also tends to decline with age. We call it presbyocusis. The second category of patients will be those who have diabetes and other comorbidities requiring ICU stays and all those things. So these patients also tend to have hearing loss, and these hearing loss are generally associated with the event. For example, a certain spike in blood glucose levels, which has been poorly controlled, or you're not taking your medications very well. In these patients also there tends to be a hearing loss. Of course, in this category, the hearing loss tends to be more abrupt than compared to those patients who have a natural progressive hearing loss due to age. Then finally, the third category of patients will be those patients who are exposed to certain medications. These elderly populations are more prone to hearing loss due to medications compared to the younger population of patients. In all these cases, we need to do a hearing test, and based on the amount of hearing loss, we have to take a call as to what should be the best mode of treatment, whether it's going to be hearing aid or anything else.
So, doctor, what are the most common ear infections?
Right, Ashwini. So, ear infections are very common, and as we typically say, it can be due to virus, it can be due to bacteria, and it can be due to fungus also. So, as you know, the ear has got broadly classified as having three parts: the outer ear, which extends from outside ear all the way up to the eardrum, and it includes the ear canal. Then we have something called as the middle ear. Middle ear falls behind the eardrum, and that is where the bones of the hearing will be in there, and it is connected to the nose. And there's something called as inner ear, which is deep inside the bone, which is also associated with our balance system. So, like I mentioned, ear infection can be due to viruses, it can be due to bacteria, it can be due to fungus. So, fungal infections are particularly common in the outer ear, while middle ear infections are more common following cold, cough, and these can be due to both bacteria and virus. Inner ear infection, on the contrary, are more common due to viral infections, and they tend to be most serious. Certain infections affect certain specific age groups also. For example, fungal infections are very common in elderly patients and even in newborn patients. Middle ear infections tend to be more common in pediatric age group because they have what we call as a dysfunctional eustachian tube, or the tube which connects the nose to the ear. And finally, fungal infections are more common in patients who have diabetes, those patients who have habit of digging their ears. So, different kind of infections require different kind of treatment. Of course, we have to make the right diagnosis first. So, ideally, we should see a ENT doctor first before we classify the infection, whether it's involving the outer ear, middle ear, or inner ear. The treatment will follow based on the diagnosis.
So, doctor, if a person who has a cold develops a hearing loss, so what should they do?
Well, that is a very common entity, in fact. Okay, cold-related middle ear infections are very, very common, and in most cases, it's generally temporary. Okay, preceding problems can be severe ear pain. Pediatric populations, children between age group of 1 to 2 years up to about 10 to 12 years of age, fall in this category most often, and even a trivial amount of ear cold can affect their ear. So typically these patients will have severe pain, particularly at night when they are sleeping, and thereafter they may also have some vomiting and stuffy nose and things like that, and eventually they end up with a hearing loss. This hearing loss is temporary and usually due to fluid or glue which is stuck behind the eardrum, which interferes with the free movement of the eardrum and the bones of the hearing. For these patients, typically it's very easy to examine under microscope and make a diagnosis. A hearing test in the form of pure tone audiometry and an impedance audiometry can help to confirm the diagnosis. As far as the treatment is concerned, we try to be observant in these patients with the initial course of antibiotics and painkillers and nose drops to begin with, and then we follow up these patients. Surveillance is important, so these patients, we also ask them to come back after 15-20 days of treatment and see whether things have resolved or not. In certain patients, which is less than about 5% of the patients, they will not resolve, which also means that about 80 to 95% of the patients will resolve within a month to 6 weeks of time. But some patients who are not very fortunate tend to continue suffer from hearing loss. These patients may require a form of a surgical treatment where we have to make a small stab into the eardrum and suck out the glue or the fluid which is behind the eardrum, along with putting a stent so as to allow ventilation to happen in the middle ear. Well, like I mentioned, this subset of patients is lesser. It's about 5% of the patients who continue to suffer from hearing loss due to cold even after 3 months of treatment.
So, in case if a person has a permanent hearing loss, what are the treatment options that they can go?
Right. So when you say permanent hearing loss, I assume you are talking about the inner ear problem. Okay, so inner ear problems tend to be permanent, and they have the treatment modality is variable depending on the severity of the hearing loss. So let's say they have what you call as audiologically classified mild to moderate hearing loss or even up to severe hearing loss, they fall as a suitable candidate for a hearing aid. And in those patients who have a profound hearing loss, that means, despite maximal stimulation of the ear with the loud sound, they are still not able to perceive the sound. So such patients have to be assessed for something called as cochlear implant, where a bionic ear kind of a device is implanted under the skin, and most patients do well with this kind of a device also.
Uh, I think if a kid has been assessed or has been identified with the hearing loss from the congenital thing or since they have born, so do you think what kind of treatment can be done for them? Can we
Right.
know a little about
So
it?
I will again divide these patients into two categories. One is those who have what you call as a middle ear problem, and those who have inner ear problem. So middle ear problems in children can be due to birth defects and also due to fluid in the middle ear, which we call as otitis media with effusion. Both of them can be corrected with what you call as a surgical management, which is a simple surgical management where we can either aim to relieve the middle ear of glue, or if let's say there is any bony abnormality, then that can be also done with a surgery to explore the middle ear and do the needful. Then the last category would be those patients who have inner ear problems, and those have a more severe form of hearing loss. These patients again we can identify with CT scan and MRIs and other hearing tests like BERA and steady state evoked potential kind of tests. And once we identify that this patient may not improve with the ordinary interventions like hearing aids, then we can plan to have a cochlear implant being inserted in these patients.
So, doctor, as we move to the end part of this, can we know that things that we shouldn't do with our ears?
Well, there are a lot of things we should not do with our ears. Okay, in fact, I tell most of my patients that ear is like any other organ, is a self-maintaining organ. Okay, most of the times we don't need to do anything with our ears. Okay, to illustrate that more completely, I will say that first and foremost, we should not put oil or ear drops without consultation. The second thing is we should not fiddle with our ears with earbuds. In fact, earbuds have been removed from market in most developed countries, and they serve as a source of infection. But more than infection, what earbud does is basically you push the normal earwax, which has a tendency to migrate automatically from inside towards outside and fall off. You push it inside, causing hearing loss or trauma. Furthermore, earwax are also important to protect the ear canal from infections. It tends to form as a hydrophobic layer, automatically dispelling water. So water does not stay stagnant if you have a good healthy layer of earwax. So that's another thing. Then a lot of women put safety pins in the ear trying to get rid of the earwax. That is definitely not good, because once you breach the skin of the ear canal, you are prone to severe infections, particularly with multi-drug resistant infections with pseudomonas, which requires detailed treatment with antibiotics, and it can sometimes cause severe problem. It also can cause perforation of the eardrum, requiring a much bigger intervention in the form of surgery. So ideally, we should not do anything with our ears, like I mentioned earlier. Like any other organ, ear itself is a automatic or self-maintaining organ, and we should not fiddle with it. Any problems related to ear, you should see a ENT doctor, get the diagnosis, and then it should be treated accordingly.
So there is no good coming out of cleaning our ears on our own.
Yes, of course.
So we're gonna get to damage it more.
Yes.
Thank you, doctor. Thank you so much for your valuable information. I think a lot of people will know the importance of hearing, the overall health of the ear, and when they should.
Right. Thank you, Ashwini.